oftentimes I'll get patients who've had surgery very recently and they're unhappy with how the scar looks. And there are two different groups here. One is where it was really put together poorly, or there was some limiting factor that the way the appearance looks in that moment, we know is going to set them up for a poor scar. And sometimes you'll do a revision early. One example is if the edges are completely not lined up and it's a complete shelf to begin with. But you can't do it in the very immediate phase where there's a lot of swelling, because then it's trying to sew two things together that are not at their baseline, if you know what I mean. If there's a lot of swelling and inflammation, it doesn't hold a suture well. Like, there are times where you literally have to wait, even when you know it needs a revision early on. And then other times where we know time and scar management is gonna make that scar better, and you may not need to have a scar revision surgery if you give it time, and like things like microneedling or lasers. There are definitely ways to make it better without needing a scar revision. So it really depends on why it looks bad to begin with, and if there are things we can do short of surgery. But say it is something we want to revise surgically, we want to give it enough time to heal typically. So that's going to be on the order of months. It's not, 2 weeks later that we're going to revise it. It's something that we kind of do case by case, because everyone's scar is so different. Everyone's inherent natural scarring tendencies are different, and how well people respond to certain scar therapies is different. So it's really individualized.